Good evening. The time is 5:30. I am calling the July 9th, 2024 ECT Board of Directors meeting to order. Please turn off or silence all cell phones for the duration of the meeting. Anyone that wishes to make public comments, please fill out the form located on the table left of the podium. Ms. Alma, could you please begin with roll call?
Commissioner May, Stephanie White, Keith Leonard,
Here.
David Peden,
Here.
Tori Woods,
Present.
David Williams,
Here.
Tina Kane, Judge Williams, Dr. Northup.
Here.
Thank you.
Thank you. We have a few new faces here tonight. The board would like to welcome the Honorable Thomas H. Williams to the platform. Judge Williams will be taking the place of Judge Harris. A huge thank you to Judge Harris for his time and valuable input on the board, and we look forward to working with you, Judge Williams. Oh, sorry. Lindsay, would you like to formally introduce the new staff to everyone?
Well, good evening, everyone. I would like to welcome Deborah Ray to our team as our new Director of Programs and Performance. She's already hit the ground running. It's been really wonderful. So we'll be hearing more from her probably in the future. So this will be her first official meeting with all of us. So we got 2 newbies today.
Welcome, Deborah, and we look forward to working with you. Mr. David, 1, 2, would you lead the pledge?
Yes.
Thank you.
Would everyone please stand and join me in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We have one amendment to the agenda. Under operations, we would like to add the Healthy Choices Escambia timeline. Can I get a motion to approve the agenda with the amendment?
So moved.
Second.
Any discussion? All in favor?
Aye.
Any opposed? No, amended agenda is approved. May I get approval of the minutes? The staff recommends the board approve the minutes on June 11, 2024.
So
regular board
moved.
meeting. Thank you.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Minutes are approved. Treasurer's report, Mr. Peden.
Thank you, Madam Chair. Last week, the Finance Committee met and reviewed our trust finances. Our biggest outstanding liability is the contingency upon the CRA tax payments to Escambia County, and we won't have an answer on that until the county takes that up at one of their meetings, I think, coming up August or September. So with that, our report shows that there's no unusual or abnormal transactions conducted during the month. And I want to thank the Finance Committee for spending time on this, and Tammy as well for Tammy Abrams for your work on this too. Thank you very much. I'll entertain any questions. If not, we'll submit it to the record for audit.
Before we move on to the business portion of the meeting, we do have 2 public comments. Ms. Victoria and Ms. Tevin. Mr. Tevin, if you would like to come up to the podium, you both have 3 minutes each to speak. Ms. Alma, would you mind timing for me, please? Thank you.
Good evening. My name is Tevin Paget. I'm with the Leah Gibson Foundation. I'm the Chief Operating Officer and Youth Program Director. I want to address how Pensacola has been experiencing a surge in gun violence and criminal activity, which is having a devastating impact on the young generation. The city has seen an increase in shootings, homicides, and other violent crimes that involve young people as both victims and perpetrators. This is alarming and indicates a growing trend of violence among people in Pensacola. We will reach all the way out towards Molino and even Century, but we also need to make sure to focus on where there are nothing but to do. Excuse me. We need to focus on our attention where there's nothing to do but trouble, or things can lead into trouble. A few areas are Pensacola Village, Warrenton Village, and Truman Arms. The exposure to violence and trauma have long-lasting effects on their mental health, well-being, and future plans. And our youth program, it aims to address these issues by providing a safe and supportive environment for young people to learn, grow, feel comfortable, and thrive away from the streets and violence. We want to empower them with the skills, resources, training, and support they need to break the cycle of troublesome conduct, criminal behavior, harmful and negative influences, and ultimately create a brighter future for themselves and their communities. We envision a one-stop hub where they can access a wide range of services, assistance, and opportunities all under one roof. Some of the services that this space is designed for is having the basic needs like food, clothing, hygiene supplies, etc. The participants will also have access to mental health, wellness services, education, job training programs, mentorship, coaching, CPR training, and the students have access to student college fund program that grants the scholarship money as they go through the program.
Could you say the name of the organization
The
again?
Leah Gibson Foundation.
LEAD, L-E-A-D?
Leah.
Leah.
Taryn, I'm glad that you're here, but you helped some young people that I sent your way, and I really appreciate what you did. So I really appreciate it, Taryn. Thanks.
Good evening. I'm Victoria Boutwell. I am the head administration at the Leah Gibson Nonprofit Foundation. My deepest concern is the devastating demise of our young black youth. That's there with all the crime that has affected by gun violence and self-inflicted harm. The senseless killings and loss of young lives have become has become an epidemic, leaving families and communities shattered. As a nonprofit organization, we have already assisted 3 funerals on our own, and continue to receive heart-aching requests for support. It saddens me that no effort has been put in a public gathering to address these senseless killings and crimes our communities that's taken out our young youth, as well as innocent bystanders. With that being said, we are resubmitting our Children's Trust Grant application for review to be able to provide these services for the Leah Gibson Nonprofit Foundation that foundation has in place in order to help our community. Thank you.
Can I ask a question?
Yes, sir.
Okay. Just explain, just a little bit more in depth. I know you probably used your 3 minutes up, but again, tell me the uniqueness of this this program, and maybe the inception too, because a lot of people don't know Leah Gibson.
The inspiration for this was Miss Gibson, the CEO. She lost her daughter to a tragic accident, and the case was mishandled, and she made an oath and a promise to not let this happen to another family. Where we provide lawyers, because some lawyers won't take cases in Pensacola when it's injustice has been done. So that was her inspiration to bring about the foundation to help service the community.
And again, I've visited your site, and I'd just like other people to know where you're located and what building you have, if you'll just tell everyone that.
We're out at 9160 Rose Street. We have the barracks building out in Industrial Parkway. We have that building. Mm-hmm.
Thank you, and I wish Ms. Gibson would have spoken. And thank you guys for inviting me out with School Board Member Williams.
Okay.
It was inspiring. I mean, I can just tell you on a personal note, the amount of checks that I've written for young black boys to be buried, the amount of repasses that I've paid for, and the facilities as the county that we provided. I mean, you're providing a unique service, and unfortunately, no matter whether a child is gunned down by gun violence or whether he dies from natural causes, he's still your child. And so I'm very impressed with what you've done. and I'm very impressed. I mean, we fund millions of dollars to people who just take public and government dollars to do their program. And Ms. Gibson took her own dollars to help children, to help people who are getting killed, and to do that. So I'm very impressed. And if you have not submitted, I hope that you do. And I can just tell you, I'm a yes vote if you come and you bring a program, because I saw the work that y'all are doing in terms of skills teaching, in terms of helping people in their times of bereavement. So I really appreciate what you guys are doing. So I hope that you will submit. And I'll tell you, at the end of the day, I will be talking about gun violence. You know, we've had 6 shootings in my district, and so it's going to be, I'm going to petition this, because there's no after-school programs or no tutoring programs when children can't feel safe in their neighborhood. And so a children trust should make children trust us. And so I appreciate what you're doing, and I assure you, I met with Sheriff Simmons. We talked all day today, and we're going to try to do something about this
All right,
gun
thank you.
violence. Thank you so much.
Thank you.
Thank you. First item up is programs, the request for the budget amendment from Lamplighters Project Pride. Lindsay, would you like to give us a brief rundown on this request?
Yes,
Please and thank you.
Certainly. So the Lamplighters Project Pride have submitted a budget request change. It's for the positive of client service. They are taking specifically out of personnel and either voluntarily putting their time out there or funding it in a different way, but have reduced that in their budget. They would like to push that back into a vehicle purchase, because transportation continues to be a barrier for participation in getting home or even getting to the sites. And so they're giving that up. They also want to look at moving more into direct client assistance that they give around hygiene, around clothing, food, all those kind of things. So they've recognized the needs and they've asked for this change. It is above the 10%, so we definitely need to bring that to the board for approval.
Thank you. So the recommendation reads, the program committee recommends approval of the amended budget for Lamplighters Project Pride as presented. Can I get a motion?
So moved.
Second.
Do we have any discussion?
No, I just wanted to make the comment, I do commend them for all the staff that are now volunteering their hours so they can purchase the vehicle, so that's huge.
Yes.
And I just want to say I'm abstaining from voting. I'm on the board of directors for the Omega Lamplighters.
Any other discussion? All in favor?
Aye.
Any opposed? The motion passes. Next, under operations, we have Ms. Cannon to discuss candidates for the Healthy Schools Escambia ITB.
All right, thank you. So we have 3 candidates for consideration and vote tonight to serve on our review panel for our Healthy Schools Escambia initiative that's coming up. Ms. Lindsay Listyle, she has participated in other grants that the trust has done. She's deeply committed to that and has some really great experience. I also spoke with Debbie Duma, who is her supervisor at Pensacola State College, also said she is the most qualified person on staff to really look at this type of initiative, and recommended her highly as someone to stay engaged. The second was also Joel Holland from the city of Pensacola. He has a unique background that's a little bit different. He worked, I'm sure Mr. Leonard and Mr. Williams know him, but he worked in the grants management part of Escambia Public Schools. He has a very, very unique background because he worked on some of these collaboratives and grants related to health services, specifically with Community Health Northwest Florida at a time when they were looking to put school-based health services in. He's uniquely positioned not only to look at it from a school district perspective and what would work and what would be within the unique perspective of embedding in schools, but also has a tremendous amount of grant writing background as well. He comes with, of course, the support of our mayor as well to serve in this capacity. The final, let me make sure I've got it right. Yep, there it is. The final one is Ms. Terry Marshall from Framework Therapy and Consulting. She has a really wonderful background as well that I think complements the rest of the grant reviewers. She has a background not only in mental health and serving as a clinician, but she has also worked in the foster system, specifically recruitment for foster families to work with our most vulnerable children in the foster care system. But she's also worked at Lakeview on those, what they call them, the CAT teams. So they're the ones that go out in mental health crisis situations to try to prevent Baker Act. She's worked on those type of in-home services as well. So she's seen a lot of our community and what that looks like when we have mental health problems, and how there's a service response to that. So these were the three that I would recommend to move forward with. We did vet them through our program committee as well, but I'll, of course, answer any questions that you may have regarding them.
No questions?
Can I ask our school board members, do either of you all have experience, insight, awareness of having worked with Mr. Holland from his time with you? I see Keith nodding over there.
Yeah. Class act.
Very good.
And I would concur, Terry Marshall is the wife of Joseph Marshall, the pastor of St. John Missionary Baptist Church, and she does a lot of great work with her on community action. She is an asset.
Thank you, Commissioner.
The staff, any other questions before we make a motion? The staff recommends approval of the following individuals to serve on the Healthy Schools Escambia ITB Review Committee: Tori Woods, David Williams. Can you pronounce her name for me?
Lindsay Listow,
And
Joelle Howland.
Joel Howell, and Terry Marshall. Is there a motion to approve the recommendation?
So move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? The motion passes. And then we also have, yes,
If
sir?
I may offer individually, and I suspect from the board, my appreciation to the three of them offering to provide that service to the community and to the board.
I agree. Healthy Schools Escambia timeline, Lindsay?
Yes, thank you for the last-minute switch on the agenda related to this. I did receive some critical feedback Tuesday after our program committee meeting. There have been two large convenings of, I think, anywhere from 15 to 25 nonprofits that are interested in partnering together in some fashion to put in proposals for our ITB. One of the things that I've gotten as feedback from those convenings is that the timeline is incredibly restrictive for a large partnership project like we are asking. I did go back and look at the timeline. When we really looked at it, I modeled it off our previous ones that we've had. I was trying to keep things as consistent as possible. But I will tell you, I do believe that they are correct when we're looking at this. When I look at it, it's about a little over 30 calendar days, 30 working days with vacations in July. Looking at this being due July 29th, we're not going to have, I would say, quality proposals coming in, and also the feedback that I got was that that was a concern also from people that wanted to partner with the trust and wanted to put these services in. They want to put their best foot forward and make sure that it is a solid partnership, and I think that that has been pervasive in both of the convenings that have occurred as feedback. So I have an updated timeline of looking to push this for a little over 60 days with holidays included in there. Looking at pushing the deadline for submission to September 20th. That would give an extra, probably get us up to about 60 days total, working days, not calendar days, to make sure that happens. And of course, we're accounting for, 4th of July vacations and different things like that. Labor Day, I think, is the holiday in September. But looking at that, we have a timeline around that. So we could, I've actually got them. Alma, did you already pass them out? So this is the timeline that we kind of updated. The other thing that I got as feedback too was that there were questions now that these groups have met. It's spawned a lot of questions, and so we want to open back up that question and answer part now that people have had an opportunity to really dissect this. and give feedback to things we may not have thought of when we were putting this together, that we definitely need to answer and put out there largely to our community and to any nonprofit that would want to engage in this. So, so looking at it, going through this process, having our grants committee meet on October 4th, bringing that to our board on October 8th, and then hopefully bringing it to the school board for presentation of our intent to award on the 15th of October, and then negotiate it and have it official by November 1st at the latest, barring no significant issues. So I feel like it's what the right thing to do. If we're wanting quality applications, we do not need to rush that. We want to make sure that the services that they're putting forward are going to be appropriate and well thought through.
Madam Chair?
Yes, sir.
Lindsay, thank you for taking the leadership to delaying this. What I would hope that this board would be in support of is setting a precedent, because I want to tell you that when we voted on other grants, people asked for extensions, and we did not give them to them. And so they had to submit, and they had to be prepared, and we said the deadline is the deadline. I had multiple organizations in which I'm engaged in that wanted to go beyond the deadline. So I think you made a wise and a prudent decision, but I just hope that this is the precedent that we're setting, whatever the grant. Help me grow. And so and I will say that now that you did that, you helped me, because the good thing that I get to do is I get to go to like 8 community centers and visit with teachers. And I love Keith Leonard and David Williams, but I've had the opportunity during the summer, because I go to community centers to talk to the actual teachers and the teachers' aide to get their input. And so I would hope that we could look at the entire request for proposal to look at what we're doing. I mean, and so help me grow after-school programs and look at collaborations. We have funded millions of dollars, millions, to after-school programs to children who are targeted in these schools. And so I don't think that it's prudent or good stewardship that we allow for people to have duplication of services to make sure that we're not doing that. So I hope that we would engage that.
Yes, and that was some of the conversation when I hosted a workshop for this, when it came out the week after it was posted. That was part of we call it like a needs assessment, or assessing what's going on, meeting with these principals and find out who is already there. Because we do not need to duplicate, but is there an opportunity to expand? Is there an opportunity to do something different that partners up and brings a different element to those after-school programs? Yes, we don't want to duplicate.
Well, we're not going to keep paying you if you've already come to us.
Yeah. It'll make your proposal probably, it would make it more robust if you can say, we already have this partnership in the school, and we intend to be a part of making this a seamless system in our school. So
right.
yeah, yes.
And that's very important to me.
Yeah.
I mean, obviously, I don't work for the school district, but there's a ton of money that comes into Title I schools. There's a lot of feeding programs, and so it's important to me that we make sure that there's no duplication of services, because that makes taxpayers do it. If there are already social workers in the school, why are we paying for someone to bring social workers? If there are already health support techs with RNs that are visiting the school, why am I paying for a nurse? And so I hope that they will do that. I mean, if there's parent engagement, I spoke to some people from Parent University. Their focus, without our money, is parent engagement at Parent University. And so I don't think that it's good for us to be able to vote for things that are already being done in the school.
Correct.
And to allow for tax dollars, whether it be federal dollars, state dollars, or FT. Some kids in their IEP, they get hearing aid, they get visual, and also with the providers, they're building Medicaid at a high number, although we turn around money. So I think that we need to redefine this, in that we're not substituting and not allowing for our providers or those who are applying to say, I don't want to fill out the paperwork to get Medicare or Medicaid, or I don't want to do that. And so we just want to make sure, for me to vote for it and to move forward, we need to make sure that they explain all that, because low-income children get free health care. So don't tell me that you're giving them health care and we're paying for it, and you're also building the government. So the reason I really support this is because you brought that forward, but that has to be defined before they come forth. And my last thing, Lindsay, if you would add to them, is the sustainability. And, one of the other things we had in the grant is, after-school activity and youth activities. I tell you, the real work happens at NEP, it happens at Brent, it happens that I represent at SYSA, it happens with all these after-school activities. I want to see that engagement in just not a typical after-school program, because we've funded millions of dollars already to typical after-school programs. And I will tell you that the youth sports programs that because we see each other at the park, they're seeing these after-school programs are seeing kids for 2 hours, for 3 days a week, or 4 days a week. I can tell you these youth programs are seeing kids for 5 days a week and 10 hours on Saturdays, and you're having these providers who are coming and just taking the data and taking these kids and putting them in their program for 2 hours a day at Cobb Center or wherever they're putting them. And these volunteer coaches are the ones that's really doing the work. They're picking them up in Truman Arms, they're picking them up in Pensacola Village, but people are being able to be paid for them. And so that's kind of, we'll talk privately, but in general, I want you to know, and this board to know exactly what I believe that we should be doing as a board. So I support your extension, but I think that it needs to be redefined. Just not coming. I mean, if kids are not getting medical care, if they're not getting the systems that they need, we should certainly supplement that. But the Children's Trust was never intended to take the place of existing funding. So anyway, I appreciate that.
No, and I have clarified that in my workshop, but also in individual conversations with medical providers, because if they're, like, for instance, the hospitals, they see this completely different. They're like, we don't understand. How does it work? And it's never, and I have explained that directly, it's not intended to supplant any sort of insurance that they can bill. It's to look at starting up and getting going. And that may be 1 day a week. That could be 5 days a week, depending on whatever they can bring to the table. But there are other elements that are here that need to be funded as well. And so they're going to have to be some give and take, right, around that for all of the players that come to the table, because nobody's going to get 100% of 5 days a week all the time with $450,000. It's absolutely not going to happen.
Not. Just
So
the
we've got
collaboration.
to rally our community around this as well, and I think it will speak volumes about the kind of people that come to the table for this and what it brings to our community if we can do this well.
Right, yeah. I mean, and sometimes people see a pot of money. I mean, no different than our Help Me Grow program. It's very simple. USDA provides lunches for all at-risk kids who get free and reduced lunch. Well, many people put in their line item that we need to provide food for them during the summer. All they have to do is fill out the paperwork. I mean, we have less sites than we have resources. So just because you can come to this trust and get money, doesn't mean that you shouldn't fill out the paperwork to make sure that those kids have USDA. And so if there are services that are being provided, we have to take advantage of those services and not build this trust, because if not, then we are not good stewards. And so I think that you're right, the amount is low, but we have to have that collaboration, and I would love to see that in the proposals. If not, I mean, people vote how they want to vote, but I can't vote it if they don't do that. If we're already funding an after-school program at school X, why are we going to fund you to do the same thing for the same children? That's unfair.
Yes, sir.
Yeah.
And I'm going to add that to our question and answers that we publish out as well. So thank you for bringing that.
Thank you, Lindsay. Appreciate your help.
Yes, so I think that's,
What do you need from us to extend this? Is there something that you need? Do we need to vote to change?
yes, I think we need to vote on it. We voted on the timeline originally and pushing it out. So I think that we need to call a vote for the extension and make that official. And we will post it tomorrow.
So can I get a motion to?
Madam Chair, I have one further itsy bitsy, but for clarification, we note that the response deadline on the form that was just handed out by September 20th is 5 p.m. Central Standard Time. Daylight savings time runs through Sunday, November 3rd. So that will be an hour off if we leave it as it is. So just until you also list down under October 4th, there's another reference of Grants Committee meeting from 9 to 11 Central Standard Time, and that would be corrected to Central Daylight Time. So we all show up at the right time.
Thank you. I did not catch that. Appreciate it.
I just go by the time on my phone.
I mean, this is what we need. We need the technical review, so I appreciate it.
May I get a motion?
Motion approved.
Yep.
Second.
Do we have any further discussion? No discussion. All in favor?
Aye.
Aye.
Any opposed? The motion passes. Lindsay, do you have an executive director's report for us this month?
Yes, I do. Okay. I'm gonna get it. I can't ever get it to work.
Mike, you gotta help her.
It's just not,
It isn't like.
it's
you-
not presenting. She has to turn it on back there. Here we go. There we go. Perfect. Thank you.
Mike. All right, thank you.
I'm just glad it wasn't me that time. Okay. We've had a really busy month. With our board, of course, we've held our program finance and executive committees on July 1. Really in operations and outreach is where we've spent the bulk of our time. We've completed all the site visits for our mental health providers. You guys are going to be hearing very shortly from Twin Oaks, who is one of our mental health providers, has an amazing program. I want you to hear it firsthand from them. We also, as we've onboarded Miss Ray, she has jumped in and started going with us to all these site visits and is starting to go to OST, as well as the other mental health that she hasn't seen and some of that summer programming. So we have some hands-on. So we're breaking her in with site visits and grants and contracts to begin with. Want to address some of the end of the year data. We talked about putting that off because we didn't have the end of the year data from the schools. We have all of that right now. Rick has compiled the majority of it. We're looking at it and asking some clarifying questions, but we've got the report basically put together. We're going to be bringing that to our program committee to review and look at. We will get it out to all of you as well, but we do need probably Dr. Northup and his technical review on some of that to make sure we're not missing it. But we want to make sure the information that we have is matching what our providers have and they understand what's going to be shared, whether that's good, bad, or indifferent. So we'll have that to you soon. I mentioned earlier that we hosted an ITB workshop, which was really great. The room was full, and we had a bunch of people online as well. They asked a lot of really great questions. It was very clear that a lot of them have never done a partnership type of opportunity before, so there were a lot of questions about that, and even some that have had some questions. So that lets me know as well, this is going to be a pretty heavy lift and something very unique for our community. And no one's done it before, so we're all learning together. Also participated in a trim compliance workshop. It was an intense hour. We'll be following up on more of those as we get closer to time for our trim hearing. For communication and outreach, just want to let you guys know we've had some really great things happening this summer. Dixon After Hours, I had to repost it on Facebook. It was so great. They did a Matilda Jr. musical, and they did it at UWF. These kids learned this in 4 weeks, and the little girl that was the lead had never performed before, and she was amazing. So it was great to see what's happening in our summer programs and then the application of that. Also got the opportunity to go to the J.B. Washington summer camp. They were out at Gateway Church, and the room was full. He asked me to come give a little speech to the kids, so we talked a little bit about grit and overcoming challenges. But they're doing some really unique things, not only around basketball, but around the art, and also keeping those kids engaged. They're actually making tennis shoes out of paper. We have pictures of it. We'll have to post them. They're so great. So they're engaging them in a lot of different ways. I got the opportunity also to go to the Greater Pensacola Chamber to their coffee and conversations and be able to present about the trust, where we're going. They asked a lot of questions about the ITB and how they could also be supportive. So that's something that's very important for anyone that's applying to know, is that the business community is rallying around this and wanting to know how they can help support these initiatives for the sustainability. And then I got some feedback I thought was really great on the family resource guide. We pass those things out, we order them, and sometimes we order, and we didn't order enough this time. We had to order a few more. But I actually had a principal, I asked her if I could share this, but she texted me and said, is this, the trust, did you guys put this out? And I said, yes. And she told me that it was really great because she had a parent that came in that they rented a place that was unlivable. And she was able to actually pull that out, highlight everything that they would need and people that she knew, and directly connect this family back. Not that she was going to solve the problem, but she was able to have a resource right there. So it's not always just social services that are utilizing this. Our schools don't ever know what's happening. People are coming in, as well as other businesses, and they have that available to resource. So that was a really great thing that we've invested with and the board's approved. So thank you for that. And that is my report. You guys have any questions?
Nope. Thank you.
Lindsay, you were not here, and Sheriff Chip Simmons, who I've been meeting with, and a lot of things have been in the media in terms of all the young people, 18 and under, who've gotten shot. The sheriff brought forth a proposal in terms of a real-time crime scene.
Yes.
And I think that it's important. I mean, I think that throughout our neighborhoods where kids are being killed, you know, after-school programs, Help Me Grow, will never be efficient if children can't come outside. I would just ask you to reach out to the sheriff and see. I mean, it's an unsolicited proposal, as we've done previously for other organizations. And how can we work with the sheriff to provide safety at our playgrounds, at our community centers, in our neighborhoods? And I think that he has a real plan, and he's laid it out, and I think that it fits, you know, maybe not our strategic plan, but it certainly fits our mission. So if you would
Okay.
talk to the sheriff,
I'll be
would
glad
love
to. I've tried to connect multiple times, but I will
So, Lizzie,
reach
can-
again. I'll
can
reach
I-
out again.
Can I clarify in this? With the proposal that we received was that program was for a school. So unless that does something else, it was
I can go back and revisit it. I
it
actually
was like
went.
the virtual program was helping them if there was a shooting at a school.
Okay.
So that was kind of the issue we had. So unless that changes what
Like supplanting, like in the schools, like funding the schools?
it was
the
like
kind of-
helping the police officers do virtual if somebody came into the school and shot it up. Like it was a graph of design of the school, and they were
Okay.
able to go in and do, like if they came
It
in.
was training. It was virtual
It was a
training.
training.
Okay, yes,
So it
yes, yes.
wasn't,
Okay.
It wasn't, unless that changes, but that was the hiccup. we
Tori, I'm
had.
not really aware of that, but I mean, but if that was the case, I'd be very supportive of it, because.
Oh, I'm not saying don't support it, I was just clarifying that it wasn't like an outdoor, that was why I kind of went back, because what it was providing wasn't something that aligned with what we were doing.
It was
was-
late 2022, right?
Yeah,
When this-
it was a program that had, what I understood, all of our schools, the floor plans, the layout. So if they went to Washington High, they would know what that school looked like. Or if they went to PHS, they would know what the floors looked like. So it's training them in advance that they have to enter a school. And actually, I thought that was a good program. I think there was more heartburn over the movie nights out there. But that was it was a 4-4 vote, and the prior superintendent voted no, and the school board member voted yes. So it died at 4-4 vote that night.
Okay.
But I mean, I'll be encouraged to see the sheriff bring something back. I was disappointed it failed that time.
Mr. Peden,
Yeah.
me as well, and Tori, I mean, we bump into each other every weekend, and Stephanie, all of us could get violations because we see each other at the football field. But simply, children can't even go to basketball and football games. And Superintendent is shaking his head. And even at Little League parks, it costs $50 an hour. And so those
I know.
parents who are
We paid
volunteering.
$65 an hour.
$65 an hour, and parents, you know, you can't sell enough hot dogs and nachos to pay that. And so what the real-time crime scene, where the sheriff is able to put those cameras in our gyms, in our football fields, they're able to detect people who are walking in to do mischief.
And if that was included, like, I think that would be a great idea.
So I'm looking
Yeah.
forward if the sheriff would bring that. I mean, because simply, you know, when we had the violence on the beach for the spring breakers, they implemented that, and the violence came down. And so, I mean, children should not be able to go to a football game and walk around the stadium.
Oh, you know,
I mean, that's
now we have to
un-American to me.
We have to have 2 securities this year, and this is
At
not-
Little League.
Yeah.
But you go to PHS on a Saturday or Washington, and I'm telling you, it's like you're in prison.
Mm-hmm.
You know, and children can't walk around. I mean, and so we need some to deter crime. And in our parks, I mean, you know, I'm a county commissioner, but we create parks. But when our children can't go to a park, because they feel unsafe. We can create all these programs we want, but safety should be our number one priority of taxpayer dollars. And so all I'm saying in an unsolicited way, I just heard from Mr. Peden, and I hope that we can find support, that we work with our sheriff in making sure that we can put tools that will help us. I mean, he quickly, in Montclair, we don't have all the cameras we need, but because of those cameras, 70-year-old lady was shot, and Streeter jumped off the bridge. And I mean, I know, I'm sorry, Streeter.
Yeah.
But they were able to catch those 3 people because they were able to identify the car, identify the person, and apprehend them. This will not stop the shooting. It will not stop the killing. It's another tool in the toolbox that allows for law enforcement to make our community safe. And it's justifiable because our children need to be safe. You've been there. I mean, we've been at
Oh,
the
yeah.
key field
I mean,
when they
I think
they
that's
shoot
a
the whole
great
park
program.
up.
That was just different from what came to us last time. What you're talking about is a little
respect
different.
that. Yeah, we had a killing at Bellevue.
Yeah.
It was thousands of young children.
Oh, all my friends were right next.
yeah,
The
there.
12U team was right, like literally.
When
saw
Mr.
dead
Trimmer
bodies.
got shot, he played
Yeah.
for me. I understand, but you know we got to have those cameras. And quite frankly, when people know that they're being recorded, they're
Less likely to, because we asked the city,
Right.
NEP did ask about cameras. So I mean, I don't think that's a terrible idea, but we have requested like cameras at our facilities for that just reason, because our box has been broken into, the little.
Yeah. And the good thing about our parks is, and I've talked to the sheriff, he wants to buy some of those remote cameras that when there is a big event, there's a Soul Bowl, there's a Jamboree, that he will bring those cameras in, and it will be monitored when people walking in, they're walking out, and it will provide for safety for grandmama and auntie to be there. So listen, I don't know all the details. I'm just asking staff to go and work with the sheriff, and I've worked. I know that he's ready, set, go. And if it's good enough for Pensacola Beach, for spring breakers, it certainly has to be good enough for children in our community.
Well, if I need you to make that connection, would you help me with that?
I think the sheriff is watching right now. He's excited
Awesome.
about it.
Good. Thank you.
Ms. Wood,
Yes, sir.
I'll help with that as well, Ms. Cannon.
Okay.
I just wanted, I know it's never a good idea to correct a county commissioner, but I want to make sure I correct you on one thing. You do,
I stand corrected.
you do work for the school district. Everybody in this room works for the school district. All the citizens in our community work for the school district. That's really what we're about. And that's really what we need. So I love you too, sir. You said you love me. I love you too. We are a partner with the Sheriff's Department as it relates to the Real-Time Crime Center. I don't know what all went down with the trust and whatever the earlier request was, but I had the opportunity to talk to Ms. Ray, Sade Ray, before this meeting. I had the opportunity to talk to Deborah Ray for a long time, many years, as a good friend and as a colleague at the school district. But the number one thing that I tried to express to Ms. Ray tonight was our responsibility as a school district is the number one responsibility is the safety of all of our students and our staff. Whether it be in a Montclair neighborhood, the Workman neighborhood, or in Bratt. That is our number one responsibility. But until we get these young people to value life, and we begin, Mr. Williams and I talked about it again this afternoon as we were walking into this building, conflict resolution. Use your words. Use your mind. But that is your right. Lumen, that is our responsibility. That is our school district's responsibility. And if I can convey anything to this audience and any of those that might be listening, that all of you work for our school district. And when we take that mindset, we will be successful. And we will get students ready to learn because they do feel safe and comfortable in our schools and in our community.
And Coach, and you take that, my first job was teaching at PHS, and I probably spend more time in schools than teachers, and it's of great concern. Unfortunately, I can't legislate behavior, ethical responsibility, and morals. But I do know that, we don't have all the answers, but every tool that we can put in the box that can save one life. Because I tell you, it's hundreds of thousands of dollars of investigations of taxpayer dollars every time a life is lost on the backs of taxpayers. And so, if we can work with our sheriff to do any preventive measure, that works because You know, like I know, and Coach Williams know, we're all coaches. I mean, most difficult thing is to walk into that house, no matter if that child was a drug dealer, no matter if that child was a delinquent, to walk in and look at that mom and her child is lost. It's heart-wrenching. We're going to be next week with Moms on a Mission and Cindy Martin about moms that have lost their life. She told me last night, we have 67 moms, predominantly African-American, 67 that have signed up, that have lost a child in Escambia County. So if I can do anything to help prevent and making that 66 and not going past 67, I want to make sure that we do it. And so, and then the good thing about Lindsay was not the executive director, nor were you on the board. I sat on the board, and I probably was on the losing side of where it was. But anything that we can do to prevent the violence and apprehend them, it's not going to stop them from shooting, but it certainly will help the sheriff put another tool in the toolbox to apprehend those who are committing these crimes that are really affecting our community. And so, the problem is, the multiplier effect, Keith. Quite frankly, so, emotional time. When kids got shot up at McGee Field, I was there. Kids from Gulf Breeze were devastated. Kids from Gonzales Court and Alice Court sat there and watched and said, ooh, ooh, ooh. That becomes a mental illness. That becomes that they become immune to the violence that's happening in their community and to make that acceptable. And so unless they see Junebug get arrested for committing that crime, they think it's okay. And so anything that we can do to help apprehend Junebug, I think we should do it because it's the safety of our children. Why are we funding after-school programs, these programs, and kids are afraid to come? So I appreciate, I'm on board, Keith, with anything the school board does.
And Madam Chair, I just want to say, I think this falls in line with the Gibson project, that they probably could address some of these issues when they reapply their application, and it can help with the violence in our community. Because we've got to be preventive and also safe, but I'm hoping that when you resubmit your application, that what you've heard tonight, that you will also include that in your application.
So I just want to clarify, we don't have a grant open right now.
Okay.
So we have not opened grants. The only grant we have our opportunity is the ITB. We don't have anything open.
Okay.
I'm sure the grants committee, our program committee can look at where we are, but we don't have.
No,
current
the only
program
other
open.
opportunities would be Match or Sole Source. And I've been working, of course, they're a really great group. I've been out. Some of the things that they're doing are not necessarily sole source yet. It's forming though, and this could be another layer, so.
Well, I mean, Madam Chair, I hope I was out with Coach Williams. We do sole source, and we have sole source. And unsolicited proposal. If they're doing something that's unique that no one else is doing, I hope that they can sole source and bring something that's forward that can be beneficial for the kids. And so I had the opportunity to actually see the work that we were doing, and so I certainly support what they're doing.
Madam Chair, I make a
Yes, sir.
comment that I think segues with all of this as well, and it's to reflect back on a couple of presentations we've had here, including Judge Danheiser came down here. My mentor, Dr. Reed Bell, and others have made. Lumen, I noted that any number of your comments reflected on the moms. And I'm certainly not downplaying their vital role. But what I think the community would benefit tremendously from is a true, effective fatherhood initiative. We have not, there's a paucity of males of all races that are actively involved in the rearing of their children, the mentoring of those children, the role modeling for those children, et cetera. And I think there's a huge need and therefore a huge opportunity for some expansion of activity in that area.
And Healthy Start just received some funding from the state to do an amazing fatherhood program. So if we maybe can connect them and maybe partnership with them might be a good idea as well.
Well, the Healthy Start Coalition, which is looking at outcomes of pregnancy and children up through age 3, has got an active role program in that. But again, it's a tiny little speck to address the need that exists in the community. And again, my mentor, Dr. Bell, would tell me we have no problems, what we have are opportunities. He was an incredible optimist, but nonetheless, I think there's a huge opportunity that exists in this community for a concerted expansion and recognition of that vital role.
Dr. Northup, and thank you. And so I don't know if you remember Human Relations Project Contact, the Fatherhood Initiative with Eugene Brown and Dr. Bell. I was a part of that. And you're exactly right. And listen, I've listened at hours of Judge Danheiser as he sat there to sentence particularly young African-American kids without fathers. I was at the health department today where a young lady had 5 children and no father, and we had that conversation, and you're absolutely right. And I see Leroy Williams here. One of the things Leroy does at Ebonwood and Brownsville and Inns and Lexington Terrace, that he gives incentives. If the daddy comes to register the kid, it's a reduced fee, because we know there is an absence of the father in black and brown and poor neighborhoods. And, whether by design or by circumstances or whatever it is. And so I agree with you. So I've been on that. I mean, Dr. Bell would say a mother can raise a child from boyhood to manhood, but she can never show him to be a man. We need men there. And I will tell you, when Judge Danheiser came here 2.5 years ago, I've been yelling and screaming, bring the fatherhood program here, and I'm going to vote with 2 hands, because I agree with you. We need fathers and real fathers for our children. So I agree with you, Dr. Northup.
Lindsay, could you possibly go back and look, or maybe Ms. Alma could help you, because there was an opportunity what the board had where we were talking about adding funding for like unsolicited things, which are what these seem to talk about, but the board decided not to put that into our budget. I don't know if you remember, but we were at the community center, Brownsville Community Center in the back, and we were having a budget meeting. So I don't remember exactly. Tammy was the executive director, but we had talked about some kind of funding, like where we could do these type of things, but we decided not to fund that. So I'm not sure if that's something we want to revisit, that maybe these would fall under, because a lot of the other programs, not saying they were great programs, they just didn't fit in what our strategic plan was. And so that's why we had looked at doing this like emergency funding type line item, and then we decided not to do that. So I'm not sure if that's something we can look at and maybe figure out how that might fit in.
Sure. No, I think that's great, because also if we are super restrictive in what we're looking at, we're not going to address the things that are actually happening in our community, which is what we're funded to do. So if there's a surge of gun violence, which this is the second meeting that we've had people come and share their concerns and as an outcry for support, we need to be looking at that. It's part of our job to look at that and be able to figure out a way, if there is a unique opportunity that we can fund and how we can do that.
And there was an ask
then we
to
need
have
to
that
do-
money, so I don't.
So there was an ask.
Yeah.
We can go back and dig that up. So I'll bring that back to program committee
Yes.
for our next meeting,
Thank
what I
you.
find. Sure.
So,
And I'll review the sheriff's proposal as well. So I'll have that.
so moving on to the guest presentation, Lindsay, would you mind doing the introduction, please? Thank you.
I would love to do the introduction. They have been patiently waiting in the back. I'm so glad that they're here. We had the pleasure of doing a site visit. Well, Michael, we did a site visit to Twin Oaks, which is one of our mental health providers. Escambia Connects is the name of this program. They are making major headway in our community. And so I'm going to introduce Tony Reed, if he will come on up and start the presentation for you all. So I'll turn the mic over.
Thank you, Escambia Children's Trust Board, for allowing me the opportunity to present tonight. I'm Tony Redd. It's R-E-A-D, so everybody, it's okay. I'm used to that whole life. I represent Twin Oaks Juvenile Development. I'm an executive director with the organization. We're the contractor that you've contracted with to provide the informal mental health services. Escambia Connects is the name of the program. As you can see, we're excited in Twin Oaks to be able to bring that into the 32501 and 505 zip codes. We've been a provider here in Escambia County through Project Connect. You would know us as, Judge Williams probably knows us as Project Connect through our DJJ contracts. We've been working with DJJ for years and years 26 years in existence for Twin Oaks. We're a Florida company. But we don't chase contracts. We chase opportunities to serve youth, serve children where we can make a difference. And so this was brought to my attention by my staff last year. And so I went over to ECT for the presentation. I was like, I get this. This is Project Connect in the informal mental health sphere. I'll give you an example. One of the tenets of Project Connect is to provide education services, connect to education services. I have full faith in the 41 counties that we work with in Project Connect that they can all educate a child. My job is to ensure the child gets in the seat, they're protected, they have food, they have a place to live, they're free from the threats of gangs, all those things, overcoming the barriers for them to get to that formal setting. That's our job. This does that in the formal mental health sphere. In other words, you have providers in your county and community, and your needs assessment determine that you have the formal systems. That what is needed in the 501 and 505 area zip codes is the ability to get those children and the families first informed of mental health, and second, connected to mental health in a formal way. But in between that, providing them supports and to overcome the sustenance needs of the youth so we can prevent them going into the formal system. So that's our job. That's what we're here to do. Very excited to be able to bring that. When we went to the presentation last year, I was like, this is a gotcha light bulb moment. This is what we want to do in Twin Oaks. So I'm going to turn it over, get out of your way, and turn it over to the experts, the people who do this job each and every day. These are the experts. These are the gems. First, I want to introduce Mr. Jason Riley. He's our outreach coordinator. He's going to talk about our tiered services in Tier 1 and Tier 2. So I'm going to, you see that in your handout there, a pyramid slide, if I get this right. There I go. And Jason's going to talk about Tier 1 and Tier 2. Sir.
First and foremost, good evening. Appreciate you having us. I'm Jason Riley. I'm the outreach coordinator. Tier 1, we provide a lot of our outreach and awareness out in the community. Some of the sites and the places that we've gone have been the flea market, local sporting events, churches, parent university, as well as area housing. But the barbershop is part of our component where we're providing free haircuts to youth, as well as the barbers are providing mentoring to the youth that they're engaged with. Our community advisory board consists of educators, law enforcement, pastors, as well as local business owners. In Tier 2, that's our informal mental health specialists. And tonight we have 3 out of the 5 present. And what they do is they go into the home, they meet with the kids twice a week, and they provide a minimum of 15 to 20 minutes with the kid where they present our psychoeducation curriculum. Now, part of our psychoeducation curriculum, we address anxiety, boundaries, self-awareness, and self-care. Some of the pro-social activities that we do, the kids have been going, today, if I'm not mistaken, they attended the Chappie James Museum. We also have gone to the Afro-American Heritage Society. And that's Tier 1 and Tier 2. Thank you very much.
Thank you.
Oh, hello, good evening. My name is Sonia Flipchek. I am the lead case manager for Tier 3. So Tier 3 focuses on family and sibling relationships. Since the majority of our referrals are from the Department of Juvenile Justice, be it youth or their siblings, there is some chance that these families have experienced trauma from involvement with the legal system. That is why the Family Reintegration Circle, or FRC, is an integral part of Tier 3. The FRC assists with establishing goals, as well as identifying points where the families can unite and heal from within, which will have a rippling effect on their communities. Tier 3's curriculum focuses on resiliency skills, building that with personal needs of each youth. Oftentimes that's educational assistance or vocational training. Tier 3 is comprised of myself as well as 2 case managers. We have Ms. Vanessa with us today. Thank you so much.
Thank you.
Hi, I'm Eunicia Jukic. I am the Mental Health Connects coordinator for Tier 4. So Tier 4 oversees all of the behavioral health services for the entire program, and then we also oversee all the evidence-based curriculum that we use for our youth, and then we're the point of contact for all the mental health service providers in the community. The main goal of Tier 4 is to connect our youth to mental health services as soon as possible. So for example, last week we had in the child welfare system, Department of Children and Families, they sent us 3 referrals for youth that have been in care since May. And there was a need for mental health services, but they said because of the waiting list, they weren't able to get them. So we got the referrals on Friday. By Friday afternoon, they were in our program, and by Monday afternoon, this past Monday, they're already receiving services for mental health. So we just want to thank you for the opportunity to provide these services for our kids.
And I want to emphasize the point that one of the tenets of this contract was to break down the barriers again from 32501 and 505 youth to be able to get direct services into mental health. Through UNICEA's efforts, 19 providers have waived the wait times and are giving the 501 and 505 youth children direct access. And so we've broken that barrier down right away within the first 8 months. I got to give her full credit for that. I can switch sides. Okay, Selena Hayes, Northwest Area Director, is going to cover our program goals so far.
Hello. I wanted to provide some additional examples of how we're meeting the program goals, some examples that aren't necessarily listed here. To bridge the gaps, Escambia Connects has joined the Mental Health Task Force as well as the Escarosa Suicide Prevention Coalition. For access to services, we have a single point of contact that communicates with all of the formal providers to make a smooth referral process. 100% of our youth that have been identified as needing formal mental health services have been connected to formal mental health services through this process. We've also had a group of professionals provide pro bono a PTSD group for some of our boys, and we've also had a youth that had no waiting list to get into equine therapy. And again, that's Nemesia. The program continues to be culturally responsive it's implemented from an Afrocentric perspective. It's community-led, and we also get feedback from our participants on their satisfaction in the program. Our recent participants in their satisfaction surveys indicated that 100% of youth benefited from the program, and that 100% of the caregivers would be likely to enroll their kids in other ECT-funded programs because of their experience with Escambia Connects. Assessment is ongoing. It's not just at the beginning. Our staff are in the homes, so they're able to do ongoing assessment of what the resource needs are, and what the family needs to support their mental health. We use the ECT Family Guide to connect to resources, and we also have been able to connect youth to get beds. If they didn't have beds, holiday meals, books, school uniforms, clothes, shoes, whatever they may need. Our outreach has gone above and beyond our expectations. With 65 events that they have attended, our intention was for them to attend 1 a month, and they've attended 65. So that ended up with a total of 1,910 outreach contacts with youth and caregivers. They received mental health awareness, and that allows us to extend past our program participants. So we're reaching people that are not enrolled in the program. And one final example related to what the kids are learning. We had a youth in Tier 2 that, because of what he learned in Escambia Connects, he identified a peer that was having mental health problems, and they were demonstrating mental health symptoms. So he talked with the peer, provided him the 988 hotline, from mental health crisis, talked with him about his symptoms. The kid called 988 and received immediate crisis counseling and chose not to self-harm because of the services that he got immediately when they were needed. And this probably wouldn't have happened if the youth hadn't participated in Escambia Connect. So that's just one example of the impact the program's having.
Thank you.
So the last slide here is direct client assistance. I mean, Mr. May mentioned earlier about youth not having access to be able to go to a camp or football, or I'm a sports guy, and so I want to send all kids to football camp or baseball camp or basketball, but band camps, just regular summer camps. This is some of the examples that we've been able to fund through the direct client assistance. If we assess a need for self-esteem especially, there's nothing better than sending to a pro-social camp or a service or an entity that exists within the community that we could connect them to build their self-esteem to overcome those mental health challenges. So we've been able to do some of the things on the slide there that you see. Very proud of some of those things that the staff have been excited about being able to connect the children to. Lastly, you've all got a packet that I've handed out. You see our success data there. Our community advisory board is listed there. Parent surveys are listed on there. Our pyramid slide, which I love our pyramid slide. I think it explains our program all in one snapshot. For me, that makes sense. I got to have a one-pager. And so at any rate, I want to thank you again for the opportunity. When this came out last year, for us as an agency, we want to fill needs. We want to solve problems. We're citizens of the state of Florida, and we like to say we serve the kids that we serve are our neighbors, right? And so I want to thank as well the ECT staff. They have been wonderful helping us get off the floor. 8 months ago, you're flying an airplane while you're building it, but they've been excellent to work with and very supportive. Very patient with us when we ask dumb questions. But I can't thank them enough for all they've done. Thank you very much.
Thank you.
Madam Chair, Mr. Leroy, I want to thank you for the work that you're doing. One Sunday morning, we were in Publix, and because of your program and you were taking care of a young man, he is now my intern in my office. He's dressing up and is doing great just because of a Sunday morning that you had a staff person that was giving him a ride to work. And he said he wanted to work at the county and learn more about being in public service. And he's in our summer employment program, and every day he shows up and he's in my office, and he leaves here, and 2 o'clock he goes to Whataburger. So thank you for what you're doing. Thank you, Mr. Leroy. I appreciate it.
Thank you so much.
Another question regarding 2 questions I have. One is the long-term sustainability, which is one of the goals of the board here, is to provide some startup funding and support and things. And so that is one of how that is looking. The next thing, I am phenomenally impressed and love this. It was throughout my practice and before and after mental health needs among the community and pediatrics in general has far exceeded any even dreams of resources to address them. What you all are doing is wonderful. And what my second question comes to, in addition to sustainability, is noting you're serving those in 501 and 505. The board is interested in the entirety of Escambia County and the potential for reaching out, expanding in order to do that. So those are my 2 questions.
Yes, sir. So I'll take the first question. Is about sustainability. This is a unique program. I've had that conversation with Lindsay. This is, we don't see this everywhere. Like I said, we're as Twin Oaks as an agency, we're in almost every county in the state. This is unique, and it solves a problem. And I think organically, it's going to grow because of the work that you did as a board to put this kind of proposal together. Never heard of it before until last year, and I was like, we want to be a part of that. So I think, working through, we have strong connections to the CVCs. We provide emergency shelters as part of Twin Oaks, and we work with almost all the CVCs in the state as well. So I think there's an opportunity for out-year funding through the CVC process. Once they see how this is a desistance program as well, right? Just like we call that in Project Connect, desisting from juvenile behavior. This is a prevention, I should say, on this end, a prevention program as well. So we see the ability to fund that through those opportunities because of the uniqueness of it, and it solves a problem that every municipality has in this state. So I'm glad you asked that, Doctor, because I'm driving over here today and I'm thinking that same thing. Where do I go next, because it's so needed. And we see the wonderful results, particularly when you've got staff that are from here. They're taking care of their own. They're taking care, they believe in this community, and they're taking care of their own. So so organically, I believe that's going to, we're going to be working that. We had to get the plane flying first, but that's my next step. On the second part of your question was scalability. This is completely scalable, just like our Project Connect program. Example of that, February 2022, DJJ said, we need you to expand by 100 slots. Can you do that? I did it in a month. We did it in a month and a half. Had everybody in place. It's because it's completely scalable. Our training systems are scalable. The ability to expand to another zip code is just a matter of function of the ratios for what we need for staffing, and then it's just a matter of going out and hiring new staff, and we got the training systems in place. Training and quality assurance guy's not here tonight, but he's like, I call him our secret sauce, because he's the one that makes the plane. He's the engine of the plane, and I know it's working. I know he keeps it oiled and refined. But yes, sir, it's completely scalable to, in fact, and I shared with Lindsay before, we just ran out a little bit of time last year, but we wanted to go to Century because that was also proposed. And we're rural company based, where our first program was in Liberty County. If anybody knows where Liberty County is, there's one red light in the entire county. That was our first program. So, and we operate in Jacksonville. We operate Project Connect in Jacksonville. So we're urban, rural. We're built for that. And so we would love to go and provide services, in any of the zip codes, particularly the challenges of Century with the rural program. Yes, sir.
Madam Chair?
Yes.
Where is your juvenile shelter located? Is it located here in Escambia County?
I'm sorry?
You have a shelter? You mentioned a shelter?
No, sir. The emergency shelters we have are in, there's one in Washington County, which is, that'd be Jackson County, Graceville.
Marietta?
And then two in Graceville, and then two in Madison County, Greenville.
Okay. Do you have plans on replicating that here in Escambia?
We certainly do. Yes, sir. I believe your CVC, well, Mike Watkins and the CVC, now for over this way, very familiar with our work, very familiar with our emergency shelters. They are expanding greatly. The one in Harriet's Haven, that's named after my mother, by the way. Very proud of that. Harriet's Haven was established because my mother had 4 boys and she always wanted a girl. And so when we built that program, we named it after her. But Harriet's Haven is a facility for emergency shelter for females specifically. And then ones in Madison County are for males. And we've opened a third already on that site. So.
And it's much needed here. I mean, actually, the Live Foundation with them, I was impressed by them that they were letting young people, they don't have it, as large and as operational as we would hope, but there are a lot of young people who, and Keith Wright would say that can't go to school tomorrow because, well, it's summer, but they don't have a place to stay. I mean, to find shelter for juveniles is difficult.
Absolutely. So our ability to do that grew, our capability to do that built out of where we started as a residential DJJ program provider. And so we've grown, that was 26 years ago, and we've grown into many other things, including the state's only juvenile competency program that we run out of statewide out of Gainesville, and then in the facility is Apalachicola National Forest. If you've ever been to Apalachicola National Forest, it's not the end of the world, but you can see it from there. But that's where our residential program is for juvenile competency. So we're did those things, but the emergency shelters is a huge need because it's not just a sheltering, it's the type of youth.
Exactly.
Yes, sir. And so that's exactly the need we're filling because we grew. I was telling Lindsay this the other day. We grew top down, sort of instead of bottom up. We were already serving those type of youth. That's the youth that we served. And so it's a matter of sheltering those youth, because they're not coming through the DJJ system, right? They're coming through the CVCs.
So last question, and thank you for what you do. One fiduciary question. The funds that you receive locally, what percentage stays in that local community?
The what, I'm sorry?
The funding.
The funding that we're seeing from
whatever
this program that we're using in this program?
If you get funding from Escambia County, how much stays in Escambia County from admin to direct services?
I think everybody is Escambia County, as far as, of course, your biggest part of your budget in any social services is going to be your staff, your personnel. And I believe everybody here is Escambia County for that. We prioritize the Escambia County merchants as well, particularly in 32501 and 505. We've used a lot of vendors that are particularly, in that in those zip codes as well. We, I think Selena mentioned, we are very community-centric for this program. It was the challenge of ECT staff to make that so in the contract, and so we're meeting that challenge. And everything we do when we focus on how can we source that locally first, connect locally. I'd like to give those guys a card, one of my cards, so they can help me on the Project Connect in. Because, I mean, really, that type of mentoring, I can fund some of that through my Project Connect. I have a mentoring program that through my contract I can fund. We're going to pass a card to them so we can get them working with some of my Project Connect kids, because of your endorsement, actually. So,
Well, thank you.
So at any rate, yes, sir, this is the most community-centric program we run in Twin Oaks, I'll say that.
Well, thank you so much.
Thank you. So we have Ms. Meredith next. Do you have anything from legal? Nothing from legal? With no further business, we are adjourning the meeting at 6:45. Thank you.